My name is Lauren, and I was diagnosed at 22. I initially thought I was lactose intolerant since every symptom I had was dealing with milk or cheese or dairy. So I went about 4 or 5 months before I really had other symptoms, and those included bright red blood, and then anything after that was just more lethargia. I actually went to my family physician to get checked out first, and he recommended to go to a specialist if his prescription did not work out. And I think it was about a month after that it wasn't working. So I just looked in the yellow pages and actually found Dr. Gentry from there. Dr. Gentry was great. He was very thorough, very caring, and he really took time to make sure I understood what was going on, what he was going to do for the process, and what would happen from there. The first time he just did a regular exam and he gave me some medication as well, just like my family physician. The second time I came to see him was about 3 weeks later, and then he recommended to get a colonoscopy from there. That to me really wasn't scary, I guess because my parents had already had colonoscopies and they were fine. So I went through the procedure just like anyone else and just came out on the other end of having been diagnosed with a tumor about the size of an orange. And even then I wasn't very nervous. He just kept calm. I kept calm. Everyone was calm, and we just kind of figured out from there what to do. He did recommend surgery because of where it was placed. He had a couple more examinations we went through, and because of where this tumor is situated, it wasn't too far into the fat layer, so he recommended to go ahead and do surgery first, and then after that he said maybe radiation and chemotherapy if he didn't get it all. I had surgery at Retreat, and they were great. It was a very quiet section of the wing I was in, even from pre-op all the way up through surgery. In and of itself, everyone came in and made sure I understood what was going to happen. If I had any questions or concerns, please let them know. They were very supportive with my family and everyone else who came along with me, but they were very informative yet very strategic in how they're going to do things, and I really appreciated that. Dr. Gentry actually did something special for me. He decided to do a different type of surgery. They usually do emergency C-section type cut. He decided because I was so young, I might be exposing my stomach at the beach or anywhere else. He decided to cut in a different way. So it took about 30 minutes longer, but he made sure he understood what he was going to do. His team understood what they were going to do. And if any complications happened, he'd revert back to his old way, but it actually worked out well. And I believe he said he would use it going forward for younger patients as well. My surgery ended up very well. It took about 4 days to get the results, and then which that time I was still recovering in the hospital. So about 4 days later, I got the results back and everything was clear. I was fine. I was good to go. And then every 6 months after that, for the first couple years, I came to see him. And then for about once a year after that, for up to 5 years, I came to see him to double check everything was okay. I am cancer-free now. I'm still always on my radar to make sure if I see any signs or symptoms to let anyone know, but I'm cancer-free and healthy. Definitely call the office and make an appointment if you see anything that's questionable. It's better to get checked early and have nothing wrong with you than wait. Since I was so young when I was diagnosed, I didn't think it would be colon cancer. My parents were clean. There's no medical history. So therefore, I wasn't thinking the worst, but knowing what came out of it, I was so happy that I went when I did.